Yeah. Hello. I like that painting as well.
Okay, ladies and gentlemen,
Are we ready, sir?
are streaming live and recording. Thank you.
Great. And good evening. This is a special city council meeting of the Morro Bay City Council, City of Morro Bay. It is Wednesday, December 16th, 2020. It is 4:30 p.m. This meeting is being held via teleconference. Pursuant to Section 3 of Executive Order N29-20 issued by Governor Newsom on March 17, 2020, this meeting will be conducted telephonically through Zoom and broadcast live on cable channel 20 and streamed on the city website. Please be advised that pursuant to the executive order and to ensure the health and safety of the public by limiting human contact that would spread COVID-19 virus, the Veterans Hall will not be open for the meeting. Public participation may be accessed via our website on the city, and we will be providing information at the time of public comment on the screen for you to be able to either dial in or access the meeting via Zoom. So we thank you for that. This is being televised on cable channel 20 locally. With that, I will ask our esteemed city clerk if she will establish a quorum, please.
I'd be happy to. Thank you, Mr. Mayor. Councilmember Addis.
Here.
Councilmember Barton. Councilmember Barton, I believe you just joined the meeting.
Is she muted, perhaps?
It doesn't appear so. I'll come back to her. Councilmember Davis.
I am present.
Councilmember Heller. Councilmember Heller.
Here.
And Mayor Heading.
Present, thank you. So we do have a quorum. I will call the meeting to order. This is a special meeting with a single agenda item, and that is to receive an update on COVID-19 and advocacy and support of a tri-county Central Coast region for the state of California's regional stay-at-home order. Let me go ahead and ask if we have any public comment for item on the agenda only. This is public comment for item on the agenda. Zeke, sir, any public comment?
No, sir, not at this time.
Okay, I'll go ahead and close public comment and bring it back to council. I'm going to start with an overview of COVID-19 issues in the county regionally, as well as current information for you from the Public Health Director of San Luis Obispo County on the mayor's and elected officials call that I received today. I do want to give a comprehensive report for our community on COVID-19 as consideration of the agenda item today is an extremely important one. And we are seeing what is being classified throughout the state of California and many parts of the country, a massive surge in COVID-19 cases. The data that I will refer to is data from 12/16, that is 12/16 today, as provided by the County of San Luis Obispo. At present in San Luis Obispo County, we have 8,090 cases of COVID-19. The increase from yesterday is 195 new cases in one day. There have been significant increases over the past few days, and according to the public health director, we are most likely seeing a surge secondary to activity that occurred surrounding the Thanksgiving holiday, and I'll speak more to that in just a moment. As of this time, there are 29 patients hospitalized in San Luis Obispo County. with 7 of those 29 being in the ICU. I want to compare that to 1 month ago, data from 11/13. On 11/13, we had 13 people hospitalized, 29 as of today. We had 1 in the ICU a month ago and 7 today. As of today, sadly, there are 54 deaths that have been reported now secondary to COVID-19 throughout the county. 1 month ago, we had 38. Right now, the public health director has indicated that 6 cases are pending signature on the death certificate, and another 6 deaths will be added to that count, bringing it up to 60 probably within the next day because of the processing time involved in that. So for all intents and purposes, we're looking at 60 deaths as of today. Again, 6 need to be confirmed via the death certificate, and 38 a month ago. As of today, one of the issues impacting the county is the fact that there are 1,523 active cases of COVID-19. That's the highest average or actual number to date for the county, which means that there's a tremendous amount of work that has to be done on the part of the county with regard to contact tracing, follow-up, and a whole number of other issues surrounding paperwork and patient safety follow-up concerns. The majority of cases, as I've reported in the past, and this continues to be the case, occur in the age range between 18 and 49. Fully 70% of cases now are in that age group, 18 to 49, if you look at the data. Person-to-person contact is about 48% of the mode of transmission at present, with community transmission being second at about half of that. So if you look at the combination of community transmission and person-to-person transmission, fully now, about 70% of cases are due to those specific modes of transmission. I won't go over every city, but I will highlight for us, because I think it's important for us to know throughout the county some of the numbers. If you look at some of the higher percentage rates of positivity in the county, let me start with the city of Paso Robles, which has the highest number of cases in the county. 1 month ago, their positivity rate was 3.8% of their population. 1 month later, today, it's 5.8%, a significant increase in the case rate that is positive for the city of Paso Robles. For Atascadero, 1 month ago was 1.5%. As of today, it is 2.4%. Again, a fairly significant increase. Looking at the city of San Luis Obispo, 1 month ago, 2.3% of the cases tested were positive. At present, today, 3.6%. Again, a significant increase. Nipomo, 2.2% 1 month ago, 3.2% as of today. Pismo Beach, 0.86% 1 month ago. Today, 1.48, almost 1.5% for the city of Pismo Beach. Los Osos has the lowest positive case rate in the county. A month ago, it was 0.47%. Today, it's 0.96%, a doubling for Los Osos. Morro Bay continues to have the second lowest positivity rate in the county at 0.74% 1 month ago. Today, fairly significant increase to 1.27%. Individually, Morro Bay, as of today, has 136 cases confirmed for COVID-19. The other information I wanted to share came from the county call today with the Director of Public Health, Dr. Borenstein. As I mentioned, our hospitalization rate, although increased, we continue to have adequate capacity in the county of San Luis Obispo, both with regard to hospital beds and ICU beds, as well as the availability of ventilators. Staff in hospitals are beginning to get critically strained, as you can imagine. I reported on the number of deaths a moment ago. The outbreaks that have been occurring primarily have occurred in nursing homes, a certain number of fire stations across the county, the state prison also, and then assisted living facilities. Those outbreaks are increasing in the county, and again are obviously currently being evaluated by the Department of Public Health. Resources are extremely strained in the county with regard to public health staff and volunteers. As you may recall, the county set up an alternative care center at Cal Poly that has never been used, never been opened. However, it still remains available for the receipt of COVID-19 patients, not critically ill ICU patients, but regular hospitalized COVID-19 patients. However, because of the tremendous number of active cases, the number of resources required by the county and being utilized by the county for contact tracing, follow-up, et cetera, is straining the available resources. And they are reevaluating the availability of the Medical Reserve Corps volunteers that had signed up back in March or April when we first anticipated potential increases in COVID-19 to determine if there's availability for additional use of those resources to assist with follow-up with regard to patients. We have increased significantly the number of tests done in the county. We were already at a very high rate. On the average over the last 2 weeks, the county was doing about 300 tests per day across the county. Yesterday, they did more than 500 tests just in the county alone. Their turnaround time has improved significantly, although it's still somewhat prolonged at about an average of 2 days in terms of turnaround. The issues with regard to the vaccine, I think, are the positive things that I can comment on now. As many of you may have read in the news, the FDA this past week approved Pfizer's vaccine. Many of you may know the issues associated with that, not in terms of clinical issues, but storage requirements present some issues with regard to the various entities being able to have freezers that are adequate to store this vaccine at a very low temperature, minus approximately 110 degrees. The county has received appropriate freezers to be able to house or store the vaccine. And as of yesterday, in the county of San Luis Obispo, the health department received 1,950 doses of the Pfizer vaccine. Recall that this is a 2-series vaccine, meaning that initially, when you get your initial vaccination, you must follow up with a second vaccination in order to achieve the 95% efficacy rate within 2 to 3 weeks after that. So the allocation, again, has been received. The first group of individuals that will receive vaccine that has come into the county will be reserved for frontline hospital workers, especially critical care workers, patients that are on the front lines of our hospitals, our paramedics, our EMTs, and certain volunteers that will be used to provide immunizations that I talked about earlier. Across the nation, there is a second company called Moderna. The FDA is expected to approve their vaccine tomorrow or the next day, within the next 48 hours. They are prepared to distribute millions of doses across the country. The advantage of this vaccine is that it does not have to be stored at minus 110 degrees. It can be stored in a regular freezer, making the opportunity for storage much more practical and easier for most of the jurisdictions that will receive it. Again, let me be clear that the first line recipients of the vaccines in this county will be for hospital workers, EMTs, paramedics, and then also long-term care facility patients. This is a high-risk group. There have been multiple outbreaks, and so these entities will be prioritized for receipt of the vaccine. There are two other companies that are in the process of going through the FDA's approval process, but it will probably be more than a couple of weeks before those companies' vaccines do get looked at by the FDA and considered for approval. According to the national news and also our public health director, the next group of individuals that would be immunized would be high-risk patients. Those would be patients 65 years of age or older, especially those with secondary health conditions or comorbid health conditions. Let me note that it is estimated that for those of you in the general population that don't fit into the high-risk groups, it appears that the general population availability of the vaccine will most likely be in the time period of March to April. The plan is for distribution through chain pharmacies and independent pharmacies, as well as through physicians' offices or urgent care centers, etc. Again, general population availability of vaccine, probably March or April with regard to any of the vaccines that would become available. And again, the Moderna vaccine is approximately also 95% effective. These are very high effective rates compared secondarily only to measles. And it's important to note that the safety profile is outstanding with very minor side effects, basically similar to the side effects you see with the flu vaccine. And so it'll be important for communities, healthcare practitioners, physicians, nurses, et cetera, to educate patients on the safety of this. Obviously, immunity across the board and getting a handle on this awful disease really depends upon mass immunization across a majority of the population, at least 70% across the nation, in order to achieve a very high level of immunity. Let me close with this. As of yesterday, the ICU bed capacity in the super region that we are part of now, and that's the issue up for discussion this evening, which includes, as you know, Southern California, Ventura County, Santa Barbara, and our county. The percent availability of ICU beds is less than 2%. However, a majority of the unavailability of those ICU beds is primarily in Southern California. In San Luis Obispo County, we have adequate resources, adequate ICU beds, and we are only utilizing about 44% or so of the resources necessary to deal with the current numbers with regard to COVID-19. That's, I think, good news for this county, and that's one of the reasons we are looking at the consideration this evening of asking the governor to consider changing the allocation of counties that are clumped together or lumped together into a region. That's part of the discussion for this evening. I will say this, and I think this is an important point in distinction that most people don't realize. Being a former hospital administrator and a clinician, I can tell you that ICU bed availability isn't necessarily tied to a bed being available in a hospital or a ventilator being available. The critical issue is really having staff members that are highly trained, ICU nurses, respiratory therapists, pharmacists, et cetera, to deal with what we call critical patients. And so there may be a number of rooms available in a hospital, but the issue really has to do with the availability of healthcare professionals that can take care of individuals. Equipment sometimes comes into play, but we have more than adequate amounts of ventilators, regular hospital beds, and in San Luis Obispo County, more than adequate resources with regard to healthcare professionals at present to deal with the COVID-19 impact that we're seeing in this county. Very different than a majority of the remainder of California. And often, you'll see between hospitals that are located in close proximity a sharing of staff. If there's a surge in a single hospital, if there's a hospital in close proximity, often you will see the use of staff from one facility being borrowed by another to meet their critical needs. And the reason I bring this up is the realization that there'd be a possibility that we could receive resources from a hospital in Southern California versus one from potentially Santa Barbara County would be remote to nil at best. And I point this out because I think often the discussion is around absolute availability of beds, but it really has to do with healthcare personnel. So thank you for allowing me to give that significant update. I think I said I'd end with this, but I have one more thing to say. Next week, the county will receive another 3,600 doses of the vaccine. And the week after that, they're slated to receive another 5,600 doses. And so fully over the next 14 days, we're looking at probably greater than 15,000 doses being available to San Luis Obispo County to be allocated, as I mentioned previously. Thank you for that. And with that, I will turn it over to Mr. Collins, sir.
Thank you, Mayor and council members. And just to follow up on a few of those items from the mayor's discussion, staff has responded to the recent surge and to help harden our facilities and ensure that we're taking measures to keep our staff safe and away from spreading events, because we did hear about some of that occurring in other fire agencies in our county. And so we've taken extra efforts to ensure that doesn't occur, because if we lose our frontline employees, that will really make it challenging to help our community with COVID. Doing a lot of outreach to the local business community through the chamber. City Council extended the grant program, another $50,000 to our small businesses are being significantly impacted by the new regional stay-at-home order issued by the governor a couple weeks ago. Our focus for education on those businesses, but in terms of enforcement, it's really on the egregious and flagrant violations that are occurring. If they are occurring, we haven't had much to deal with, but that's sort of our focus. Because those flagrant violations are the ones that could occur that would create sort of a spreading event, which would further the numbers in our community. We are having a free flu shot vaccination clinic tomorrow, Thursday, December 17th, from 11 a.m. to 4 p.m. at the St. Timothy's Catholic Church, the parking lot, and all city staff, well, each department is participating in that, and we hope to get as many people through that clinic as possible. We don't want the flu and COVID to link up. Can have detrimental effects to an individual if that were to occur. And furthermore, this clinic is an opportunity to do a test run and distribution of COVID-19 vaccinations in the future. So we are doing that. Just to clarify a little bit, the county, right as of now, we have about 44.4% capacity in our ICU units. Santa Barbara is at about 35.7% as of today, and Ventura is at 5%, which will have bearing on the discussion that we're getting into for this evening. As it relates to that, given all the rise in cases that we've seen statewide in the county and the nation, our governor issued a regional stay-at-home order a couple weeks ago, and in the process created 5 mega regions for the state to use the metric of ICU units available in that region. Once 15% capacity is eclipsed in the negative direction, further restrictions are placed in all those communities within that mega region. And I believe at least 2 or 3 out of the 5 regions in the state have now hit that mark. That means for us in SLO County, restaurants are closed except for takeout. Hair salons and barbershops are closed. Travel is only for essential purposes. Gyms are closed. Personal care facilities closed. Only 20% capacity in our retail shops, et cetera. It's a pretty significant impact. And with that in mind, the public health officers for Santa Barbara, Ventura, and SLO County got together when this was being discussed to really look closely at what made sense for our region, more of a natural region versus sort of this conglomeration of a mega region, and what made sense from a practical standpoint on hospitalization and utilization of resources across county boundaries, and determined that there's a lot more connectivity between the 3 counties of Ventura, Santa Barbara, and SLO County than there is between us and Southern California. And that's been borne out in a lot of different agreements that have been made in the past, and just how resources are shared, the discussions that they had earlier this year around utilization of the Cal Poly alternative site, care facility site. All those things kind of brought those 3 public health officers together to say, it makes more sense if we're separate from Southern California. Not that we're better, not that we're ignoring the concern, but it makes more sense from a sharing of resources perspective. They issued a letter to the public health officer for the state in that regard, and then the SLO County Board of Supervisors, Ventura Board of Supervisors, and Santa Barbara Board of Supervisors sent similar letters to the governor asking that if we're able to, as a tri-county region, stay above that 15% capacity after 3 weeks of the RSHO being issued, that we could come together as a tri-county region separate from Southern California. As the mayor mentioned, I think the Southern California region now as a whole is around anywhere between 3 to 5% total ICU capacity. But again, in our region, we're closer to about 28% for Santa Barbara, Ventura, and SLO County. So those letters were sent out, and there's been discussion amongst the city managers that perhaps it would make sense to have letters sent from the cities to the governor as well to issue or to kind of stand behind what our public health officers are saying, as well as our county leaders. Again, not to ignore the concerns or the warning signs. We believe in the metric. The metric makes sense, but perhaps the region boundaries doesn't. So the request, again, is to have the mayor sign on to a letter. I submitted a draft as an attachment to join the other cities in support of a letter to go to the governor and request that we be part of a separate region if we can maintain that 15% or greater capacity in our ICU units. I believe all the cities have now agreed to sign on. I think all 6 out of the 7, and I think we're the last to discuss it this week. So they're all prepared to do that. So again, the purpose of the letter is to implore the governor to consider us as a tri-county region separate from Southern California, only if we're able to maintain that metric of greater than 15% capacity in ICU units. Happy to answer any questions that you all may have. I believe I have Chief Cox, Chief Knuckles, Harbor Director, City Attorney, and our Community Planning Director, Scott Graham, are all available for any questions you may have.
Thank you, Mr. Collins. I appreciate that comprehensive review and update. With that, I'm going to go ahead and open it up for council questions. Start with Councilmember Davis, sir. Do you have questions?
No, sir, I do not have any question.
Okay, thank you. Councilmember Heller.
Yeah, I have a few questions. Maybe I heard the numbers wrong, but Ventura County, did Scott, did you say it was below 5% ICU capacity?
Yeah, as a standalone county, there at this point are at 5%. Santa Barbara's at 35.7%, and we're at 44.4%. So if we were a part of a 3-county region, right, as of now, we would be at about 28% capacity in our ICU units as a region.
So are we concerned that that low number at Ventura might adversely affect the plea of the 3 counties to be considered differently?
I mean, it's certainly pulling the number down, no doubt. You know, and it could be the case that within a couple of weeks our numbers are down there. It's interesting that we didn't see, so like some counties see the correlation between case counts and hospitalization rates or ICU unit rates. There hasn't been a direct correlation that has been seen in other Southern California cities and counties. That may be because of our demographics and the fact that a lot of the folks who are contracting the disease are younger and less susceptible to the symptoms and less need for hospitalizations. So that is an interesting dynamic, and I don't know if the demographics they may be a little different in Ventura, so we may be seeing that playing out in their numbers. But again, I think we would be able to maintain probably that 15% capacity to the end of the 3-week period based on how things are trending now.
So the letter is 15%? Is that what you said?
Yeah, the 15% metric is what the governor established for a region. If you go under that capacity, then the order is triggered and the restrictions go into play for at least 3 weeks. And then they assess, after that, every week they assess what the numbers are doing and can move out of that if capacity is increased.
Do you know if there are other counties and other regions that are making their plea similar to what we're doing?
I'm not aware of other kind of regions trying to form. I do know of some counties on their own arguing that they shouldn't be part of, that they're not going to play by the rules at all. Some have sort of done that. Some cities have done that as well, and some have reneged on that and come back to planet Earth a little bit, realizing that maybe they shouldn't be making those statements. But I don't know if there's other sub-regions within mega regions that are trying to pull out or not. It seems to be the most impact is in the Southern California and the Valley region, and I think the Bay Area. They've on their own have decided to jump into this new closure just because that's what they think the numbers are going to go there anyway, so they're just going to do it now to help stem the tide. So I think it's just those 3 regions, and then I think there's a couple, Northern California and another one that hasn't quite hit the number yet.
Okay, those are my questions. Thank you, Scott. Thank you, Mayor.
Oh, you bet. Thank you, Councilmember Heller. Councilmember Addis, please, questions.
Is there concern that if we form our own area that will draw people here? Because I think the point of this letter would be if we have at least 15% capacity, that certain sectors of business could stay open, which certainly I want those sectors to stay open, and we want folks to be able to, earn a living here. But when we've closed down before, there's been concern that would draw people here and just force us to close anyway. So where's the thinking in terms of that now?
That's a great question, Councilmember Addis. The one thing I'll note with regard to travel, I think that's sort of the concern. At least during the summer months, when our tourism levels were at the highest that they've been seen in a long time, our case counts didn't move one bit whatsoever. And that's sort of been reflected in the numbers that we've been shared with us by the county health, is that tourism isn't driving numbers. It's a lot of the individual decision making occurring, a lot of family visitation, or, some things that, people don't have control over, like my workplace is in close quarters with people and there's transmission that way, or in the prison, or other factors that don't correlate and connect with tourism. So from that vantage point, I'm not sure if there's a risk factor for us, but it's certainly something that I think keep in the back of our minds. If you went full on, said we're open for business, you might not like what you see that comes out of that. So it's a fair point that you've raised. It's just we didn't see the connection to the case count actually going up.
And then I'm not sure if I understood correctly what the mayor said, that if we have, if we're connected to LA, that doesn't necessarily mean we are going to share resources with LA. Like, we could be our own Tri-County region, and we're more likely to share resources with Santa Barbara or Ventura than we are with LA, regardless of which region we're part of.
Yeah, great question. Thank you, Councilmember Addis. To be clear again, I think when people think about ICU bed capacity, they think about a bed in a room. That's partially true, but the limitations in the availability of those configured rooms, and you can actually take a regular hospital bed on an acute care floor and turn that into an ICU bed, but it's useless if you do not have the appropriate respiratory therapy, nursing, pharmacy, etc., medical staff to deal with these complex patients. And so hospitals in close proximity, especially hospitals that are, I'll call it chains, such as Dignity Health or Tenet, will borrow resources, and often between different corporations, resources will be borrowed based upon need. What the point I was trying to make is the likelihood of staff from Southern California coming to San Luis Obispo or vice versa is pretty much nil. However, there's already a good collaborative sharing relationship in the healthcare organizations that exist primarily in Santa Barbara and San Luis Obispo County, and I believe now it's also regionally firming up with regard to Ventura County. But great question.
So not being part of the LA region would really not lose services for us. It's not like if we were a different region with the metrics, we would lose any services or access to services should we become the new hotspot, so to speak.
In my opinion, yes. Of course, if all of a sudden, pick a county, any county, the case rate just went bonkers and there were 0 beds available, I think the governor would deploy resources, either federally and or state, to assist. So I think there's a greater likelihood that outside of a smaller region where there's collaboration now, that the assistance would come from the federal or state level.
Perfect. I think that's it for me.
Okay, thank you. Councilmember Barton, great to have you on board, I believe. I think you're here with us. I'll open it up for questions from you.
There we go. Okay. Now
there you are. Welcome.
Yeah. I had one tiny question, and that was, now that we know the rollout of the vaccines is coming and we know numbers of doses and that sort of thing, do we, by wanting to break out of the larger region that we're a part of, do we put ourselves in any kind of a spot where someone might say, well, you know, we've got this big LA area here. We need to get those people vaccinated, and you guys, well, you're smaller, you're whatever. Is there anything like that could be a side effect of taking this action?
Yeah, great question. So what I'll tell you from just a distribution standpoint is it's a state to specific county. And so the state is guaranteed, right, rather than the region. So it's not based upon the governor's regions. The allocation methodology has been determined by statistically the number of frontline individuals that are available, that need to be vaccinated, et cetera, in that group that I talked about. And so I guess the short answer is no, it would not affect the distribution to San Luis Obispo County.
Okay. That was my only question.
Okay, great. And Scott, did you want to make a comment?
No, I think you covered it. And you know, Chief Knuckles on the call, but I think he and I have talked about the same thing, that it's established on a kind of county by county metric.
And one of the things I did want to mention, especially for our public, is the great work that our fire chief is doing. The clinic that is being established on Thursday this is flu shots, not COVID-19 yet, but this will be not only for the immunization to provide flu vaccine to our public, but this will be a systemic test run, because the county anticipates utilizing paramedics, EMTs in local jurisdictions as another vehicle to provide immunizations to the community. And I just wanted to recognize the chief for all the work that he's done in the county and locally here, and with this flu vaccine clinic that he'll be providing. I think it will provide a good infrastructure for the future administration of COVID-19 vaccine once we begin to receive it. So thank you, Chief, for that. So with that, I will ask if there is, I'm going to entertain a motion. I would like it in a motion. If there's motion for support or not, I would entertain that at this time.
Mayor, may I make one quick suggestion that the cities are all signing on to a very similar letter to what I drafted for you all. So perhaps the motion could be to sign the joint letter on behalf of the city, something to that effect.
That would be fine.
Okay.
Absolutely.
I'll move to sign the joint letter. I'll move for the mayor to sign the joint letter on behalf of the city.
So motion by Councilmember Addis.
Second.
Second by Councilmember Davis to sign the joint letter as mentioned by Mr. Collins. Any further discussion? If not, I will ask for a roll call vote, please.
Councilmember Addis?
Yes.
Councilmember Davis?
Yes.
Councilmember Barton?
Yes.
Councilmember Heller?
Yes.
And Mayor Heading?
Yes.
Motion carries 5-0.
Thank you for your time, and thank you for your indulgence with this. Again, this is something that I didn't want to reach out and do on my own, so I appreciate the input from council on this. I do want to say to our public that it's crunch time, folks. The vaccine is coming, or basically is here, but will not be widespread. But I've got to reaffirm to all of us the extreme importance of wearing masks when you're outside, especially when you are not able to socially distance at least 6 feet from a member of somebody outside of your immediate household. Let me be clear. Outside of your immediate household. Number 2, frequent hand washing, of course, is extremely important. Number 3, social distancing in general is important. And lastly, let me just say, as we all like to gather around the holiday season, in my humble healthcare opinion, you are seeing a surge from gatherings that occurred from individuals that got together over the holiday, and I understand the importance of being with loved ones, from multiple households where social distancing, perhaps mask wearing, frequent hand washing, and especially the avoidance of congregating indoors versus outdoors. Much greater likelihood of respiratory transmission of this virus when you congregate with more than one other family outside of your immediate family, don't wear a mask, and you're indoors and you don't stay 6 feet away. So bless the holidays, but take care of your loved ones, take care of one another, and please adhere to these strict guidelines. That's just my plea as your mayor and your concerned citizen. Any other final comments by council or staff? Great. If not, thank you. Have a pleasant evening. Happy holidays to all, and we'll see you next time.
Happy holidays.
Thank you.
Thanks, Mayor.
Happy holidays.
Staff.
Thank you. Thank you, council.
Happy holidays. Thank you.
Days.